LGBTQ plus adults less likely to get HIV tests in states with refusal laws. A growing number of U.S. states are enacting laws that allow healthcare providers to refuse treatment based on personal or religious beliefs. New research shows measurable health impacts of those laws on LGBTQ plus communities. As of April 2026, 11 states have passed conscientious objection laws that specifically affect queer patients. The conversation analyzed data from over 109,000 adults collected by the Centers for Disease Control and Prevention between 2016 and 2018. It found that lesbian, gay, bisexual, and queer adults living in states with refusal laws were 28% less likely to report receiving a first-time HIV test compared to peers in states without conscientious objection laws. No similar decline was observed among heterosexual adults. The study also found that LGBTQ plus adults in those states were 71% more likely to report being in fair or poor health after the laws were enacted. Researchers identified these disparities by comparing changes in health outcomes before and after the laws took effect across multiple states, isolating the impact of the politicals from preexisting differences. The findings come as additional policy changes affect LGBTQ plus healthcare access nationwide, including reduced funding for HIV programs, limits on gender-affirming care, and legal exemptions allowing employers to deny insurance coverage for preventative medications like PrEP, HIV pre-exposure prophylaxis, or PrEP, can lower the risk of contracting HIV from sex by 99%. However, patients need to receive an HIV test before PrEP can be prescribed. If providers refuse to engage with queer patients on their sexual health, people who could benefit most from PrEP may never receive it. Oh, take a breath, right? It's very interesting because I look at this, and when I look at the data, when you look at HIV and transmission rates, it's actually our heterosexual communities that are increasing in acquiring HIV, and it's our LGBTQ individuals that are decreasing in transmission rates. So while they're coming after and they're saying they can do this, well, we all agree it's wrong. This is where I look up at you and go, find another doctor. It's time to find another healthcare provider. If they're not able to have your healthcare back in your case, it's time to find someone who can. And it doesn't mean every doctor is going to do that. There are other ways to get PrEP. There's clearly other ways you can do it online. There's a lot of things you can do through telemedicine. So I think there's definitely opportunities for that out there in the community.
Well, this is just putting numbers to legal fag bashing.
Right.
That's what this does.